Welcome back to On the Ascent Health. Today I'm joined by Marissa Scott of Aspire Med Spa, where she's helping people look and feel their best with advanced aesthetic and medical treatments. In this episode, we're talking about radiofrequency, or RF, and how it's used not just for a pretty face, but for healing throughout the body and for vaginal rejuvenation. Marissa explains what RF does, who it's for, and how it fits into the bigger picture of wellness. Because here's the truth, all of the spa treatments in the world can't undo a lack of health underneath. This conversation is all about the power of blending health and aesthetics so you can glow on the outside and thrive on the inside. Welcome everyone to On the Ascent Health. I am here with Marissa Scott at Aspire Med Spa. Welcome, Marissa. We're glad to have you. Can you tell us a little bit about who you are and how you got into this line of work and ended up owning Aspire Med Spa?
Yeah, I am Marissa Scott. I'm currently an RNFA. I started as a medical assistant.
So what's an RNFA for everyone?
I'm a registered nurse first assist. So I've got a few extra years of training to specialize in the operating room.
Cool.
And my background is in trauma surgery, general surgery, OB, and ortho.
Okay.
And I think for a while I was trying to find out what I didn't like, but I kind of loved everything. And with that momentum, I fell into aesthetics as kind of a fun side gig and transitioned into this full time now.
Okay. How long were you doing, working in trauma? And
I've been in the surgical field for just over 10 years.
Okay. And then when did you guys move in and open up this or start this?
We are creeping up on our 2-year anniversary.
Okay.
Here.
Congrats.
Thank you.
That's awesome. So still pretty new.
Yes.
So what got you? You said you started as a side gig and...
One of the general surgeons that I worked for in the past, she had a medical spa on the side.
Okay.
So I would work part-time in the operating room with her, and then she transitioned me into her med spa part-time and fell in love with it. And so once I branched out of there, I wanted my own practice and wanted freedom, and I wanted to bring more to the table than what I was seeing in a lot of the other practices. I wanted to kind of blend the beauty with the science and the health and the functional, all integrating in the aesthetics, because I think we can all agree that the healthier you are, the better energy you have, the more the beauty stuff comes up, right? We can do all the facials of the world, and if deep down you're not healthy and you're not your best you,
Yeah, absolutely.
chasing that. So that's where I was really passionate about how can we get people healthy
Yeah.
and do aesthetic enhancements as well.
So you do a lot more health related that's maybe a typical health or med spa.
Yeah, we specialize in scar rejuvenations and revisions, and part of that is blending my operating background in with where current aesthetics are.
Okay.
So we go a little bit deeper into the rejuvenation, the visionary side of it, and we're doing some fun stuff with biostimulators and exosomes, while blending that with microneedling blended with RF, which I think we'll get to.
Yeah, okay, we're gonna have to come back to some of this other stuff if we have time, because I'm very interested, especially we work with scar tissue a lot, and from what I've heard about one story, it could be really cool to work concertedly on scar tissue. So I think we talked a little bit, the bigger goal of Aspire Med Spa is just bringing more in. Let's talk about radio frequency then. And you've got a couple different radio frequency offerings. What is radio frequency?
Great question. RF is something that's really trending in media right now, and I think the most common question right out of the gate I get in consultations is, what does RF stand for?
Yeah, okay.
RF.
So people know RF, but not radio frequency.
Right. I say radio frequency, which I try to use that term more than RF.
Yeah.
Because it sort of heads off that question. So RF is radio frequency. Radio frequency is a heat energy. And there's a lot of different ways we can induce that heat. So depending on what you're trying to treat and achieve, it may change your delivery method. But radio frequency is the heat energy. For example, we can introduce it with paddles. We have a vaginal rejuvenation procedure where we insert volume in the cervix and rotates.
Okay.
It's still heat energy.
Yeah.
We have some devices where we use paddle. There are fat lipolysis and toning.
Okay.
So it's all heat related, and depending on the temperatures that you're using is kind of the modality and what you're trying to treat. For example, I may be trying to achieve subcision with scar versus fat lipolysis versus anti-aging multi-ring. So it's kind of what's so special about radio frequency is it has such a broad reach of clientele.
Yeah.
There's no one that I've ever met that's come in that radio frequency in some form or shape could be beneficial to them.
So everybody should get it.
Everyone should get it.
Let's talk about different areas. So you said face. What does that look like?
Yeah, so Face, my favorite, we have two platforms here. We have RF Smooth, which is basically a solid surface that we can do what we call basket weave technique, and we rub it on the surface of the face and we basket weave it to introduce that heat.
Okay.
We can control the heat by dials, controls, or by even just speed and pressure. So again, depending on what we're trying to achieve, we may operate it differently.
Right, and isn't there like different depths you can do it so it's like
that's
deeper
what
than the
needling.
surface?
So
Okay,
the smooth
needling.
is all the same depth. It's great for more sensitive eyes, maybe under the eye, or someone who just has a very strong needle fear.
Yeah.
But microneedling is my favorite way to use radio
Okay.
frequency. We can use it full face, but also full body. So we use it a lot for like tightening the arms or the thighs or
Okay.
stretch marks.
Yeah.
The needling method is what I need to go out for the scar revisions. And then yes, but that there is a lot of science behind it. RF, but microneedling alone is kind of its own specialty. There's like operating on parameters, and then there's operating patient assessing. It's really, really well known as I treat every patient in different areas at a different depth, and then there's some techniques of layering. For example, I can treat you at a deeper depth of what we're saying with one heat energy and then retract out, kind of on a different angle. And so the idea is you're sort of treating that deeper layer, especially if you're trying to do fat lipolysis.
Okay.
Or cellular apoptosis, which means killing the fat cells.
Right.
And metabolites.
I say like apoptosis is like it's popping the cells.
Yeah.
Basically, that's how cells go through death.
Yeah.
Is they pop and
Yep.
clear them out.
Exactly. And then we have, it's kind of like a little Pac-Man cell called a macrophage cell that comes in over time and eats those cells away. And that's where you get that very pretty contouring. So it's beautiful for doing full face, but with the scars or even contouring, I think, we've all at least experienced someone in our life, if not ourselves, where we have like one little area and we're like, what the heck? I can't, like, no matter how much I work out at the gym, I lose everywhere, but I still have this one little area. So that's why I love the body treatments, is we can be very localized to kind of contour and make it match the body.
Very cool. So lots of things. Are there any like people who shouldn't have it done, or like contraindications, cautions that you have to worry about?
There's definitely cautions that you need to be careful of, especially people who may not have a lot of great tissue integrity starting off, right? Because tissue, meaning like in your area, maybe I can penetrate. I'm going to
Yeah.
have more thermal regulation in my thigh versus where I'm pretty weak to here or my hip bones. So you do have to be careful. I would not say there's anyone who absolutely shouldn't get it unless they're on something like a medication, maybe that's causing some photosensitivity, increased risk of burns. There's several medication types. Rheumatoid arthritis is a big condition where I'm very cautious.
Yeah.
Not that they can't get it, but my grandma's been but to ensure safety. Those are the big cautions. Some medications will increase sensitivity, but that's really the biggest thing, is remembering it is a heat. So keeping in mind that different people are going to tolerate that differently, and being really careful that you breathe in assessing. Because what I treat you on could burn me. Right?
Okay.
So that's where, I think that's where people need to be really educated on their providers. Is a lot of these devices come with manufacturer parameters, and I think a lot of these injuries that we're seeing come forward are because people are using those parameters and are forgetting to assess the patient and treat individualized. So I just think people need to be educated, have a really strong background, understand the technology and have experience in using it, having mentors, having overlap training, not just getting certified and trying to do invasive treatments.
Yeah. You have to be an RN to provide all the treatments? Are they like that great medical device, or?
It's different per device, how you're delivering it. So back to that paddles or wand.
Yeah.
It's a gray area. Some states you have to be an RN. Alaska's one where, and we just got a new medical licensing for it, very excited about, where they're being strict on medical director supervision and so treatment plans. And part of that process is, again, verifying that not only have they been certified and can operate the device, but in my opinion, if someone's operating a device and a side effect does happen, you do burn someone, is the operator, or at least someone closely supervising, equipped and capable and educated and experienced to fix that?
Yeah.
Right? Because then comes wound care, then comes compromised tissue integrity. What do we do now? How do we heal? How do we treat that? How do we get you back to baseline and above baseline to achieve the goals we initially set out. So I think that's a really important question. What could go wrong? If it does go wrong, how do we fix it?
Yeah.
And do we still have a chance of hitting our initial goal? And what is that cost associated with finding?
Yeah.
Cancel patients.
Get right. You think with the boom of med spas that there probably is some like lack of control. So that's cool that they're starting to work on that.
Yeah, I love it. We've invited several of the other aesthetic practices into our clinic here. We're huge on education. Trainers from out of state all the time, and I've had people ask me, "Why are you training your competition?" And I'm like, "I'm protecting the industry.
Yes.
There's enough patients to go around. That's all we agree together."
Yeah. What do treatments look like? Are they single treatments, multiple treatments? What do you know, obviously it depends on area. So like, let's pick one or two areas.
Yeah, so great question. Area, also age, tissue integrity, and then what are we trying to achieve? So star revisions, sometimes I'll treat them 4, 5, 6 times, depending on the size, the depth. There's lots behind that. But, if I have a female who comes in and she's like, "Hey, I have really big pores, but she's gorgeous, she doesn't have a lot of sun damage."
Yeah.
She may achieve her goal results in 1 or 2 treatments.
Got it.
I have a lot of patients in their 80s, women who don't want a facelift, but their face and their skin elasticity and thinning is all really big concern to them. So I've done over a dozen treatments on them. And they just tell me I'm their monthly date, and they come in and they do it every single month. That's a pretty big, intense detail, but some of these women have age backgrounds to really fierce. They're excited. They love it. They're like, "I'm going to see you until I die every month." So I think that's cool. But my recommended treatment for everyone across the board is we love to start everyone on a series of 3.
Okay.
The series of 3 is very, very fantastic results. It's very affordable. It's a timeline that usually fits people's lives. They can get it once a month to 3 months. Whereas some people are just like, "No, I can only stage you once every 6 months." The beautiful thing is, you don't have to stick to a certain protocol. Every time you come and get it, you're going to have awesome results. And so then that becomes what's affordable. Gets into your time price.
What do prices look like? And then compare it to some other like Botox or laser or other cosmetic procedures that people are getting.
Also a great question. So it depends on the area because a lot of it is time.
Right.
So our pricing for full face, for example, is $700. Now we have a periocular. We do a lot of customized for scars if we're just treating the scar. Then it's closer to $500. Full face and neck is $900. We treat them with decolletage down to your collarbone, this in the area.
Yeah.
And then you can do add-ons, and those add-ons have discounted. So we do some tack on time.
Yeah.
I think full upper arms is $500. So it's very affordable. Here's what can be difficult about it, like the cost and patience is you are essentially inducing the body to be. So it really takes like a good 4 to 6 weeks for strong 90 days of popping muscles, right? Because you've got all of that happening down deep, and that takes time. I think where in comparison to the injectables, they're pretty much instant gratification.
Right, that makes sense.
So what I tell people is, what's our goal? Is it look good and come in every quarter, and a full face of tox is the same cost, give or take a little bit, as full face microneedling.
Yeah.
Now, full face of tox is lasting on average 90 days. The full face of each microneedling treatment is lasting 14 years. So it's like it shows your eternal baseline. So I have a lot of clients.
When you're putting a toxin in, right?
Yeah, so risk-wise, that's the other thing is like I have tons of ladies who come in and they're like, "I want to enhance myself. I don't want to look augmented. I'm 100% against injectables. I'm not even willing to have a conversation. I don't want you to sell me on it." And so microneedling is a great alternative to that.
Yeah.
Now we can do scar revisions and enhancements and improve, the virtual visual side of all of that with injectable steroid blending biostimulators. But we're not increasing cellular turnover with injectables. And so if we have like a lot of acne scarring, which oftentimes is very uncomfortable, not just unsightly, our microneedling, when you go in and you drop those needles down, scarring underneath the skin, if you look at a histology images, you've got all these little fibrous bands that adhere down, and that's why scars, a lot of times you'll get these divots and craters. those needles go in and they pop those fibers, they dissect them up to where it allows that skin to lift back up. The amount of like pain relief that we see with patients with chronic neck and needle is fascinating. Like we're doing it on a lot of men now who come in and they're like, I never thought that today I would be seen in a med spa.
Yeah.
But they can't stop coming back because they're like, this is awesome. Like my scars feel good. Like I feel good. Like they kind of have hope for helping.
How deep can you go for scars?
You can go 3.5 to 4 millimeters deep, but that's full thickness. And then on someone like me, I would, that's way too deep for me.
Yeah.
Like, for example, on my face, I treat myself at a starting, meaning deepest depth, at 1. People think more is better. It's not.
Right.
If I treated my face on the same levels that I treated a female who weighed twice my body weight, I would be eating bone.
Right.
So it's a very different, again, and that's where knowing tissues, right? Knowing those layers, and I think it's kind of nice having a surgical background because I've been on the other side of everything. It's fun seeing how thick is the skin when you're looking at it in relation to these depths. So you kind of have a different perception of what you're doing and where you are in different areas of the body. So it's a fun experience.
Do you do it other areas besides the face, the scar tissue?
We do. So we have done full body.
You have C-section scars. Those are deep.
Yeah, so that's where the subcision is really nice. Most women, if you look at their C-section scars, they have that adherence, right?
I have them. Yes,
they're
absolutely.
sore. A lot of women experience drainage issues with lymphatics, so they get exercising and they're like, why am I swelling only above my scar? And that's just those fibrous bands are so thick through there.
Yeah.
And we drop those needles a little bit deeper in those.
That's why I was asking how deep it goes, because I feel like that scar is deep.
Yeah, so I'd probably, for you, for example,
Yeah.
just looking at you without feeling your tissue, I'd probably go around 2.5 to starting and layer you. So I would do like a 2.5, and then I would do a 2, and we would do basket beating, right? So I'd run vertical, and then I would run horizontal and vertical. And I would just keep subtracting out.
Yeah.
And the layer of passes is very dependent on the assessment. How are you handling the heat? And I'm likely going to be decreasing my heat and decreasing my depth too, right? So the goal is deeper, hotter. You would tract out. You wouldn't want to treat more aggressively, more superficial, try to go through that cellular damage that you just kind of trick your body into and try and reach the tissue below.
Yeah.
So that's the idea, is more aggressive, come lower and pull up as you go while being safe, but as aggressive as possible from the most effective results.
That's awesome.
Yeah.
That's exciting.
Yeah.
That's very cool. I'll be in for that.
Those are things that are life-changing, right?
Right, absolutely. I still feel it. Like if I have my arms overhead, like I can feel the pull where like the muscles, everything's just like strapped down on top of each other.
Yeah, so I think you mentioned you met my father, who has a really, really significant scar through here.
Yeah.
And the reason I ended up doing this microneedling is because you'd be talking to him and he would grab and you'd get these really bad headaches and all of that appearance where his plates were. And I kept telling him, like, Dad, let me microneedle. My father's from Talkeetna, so coming into a med spa was not an easy achievement.
Yeah,
But
even if it's not forensic. Yeah.
100%. Finally, I got him in here. I did a treatment. Following the microneedling subcision, releasing that scar out, injected a biostimulator just to help grow more collagen because he had a lot of that gray area in there. And he's like, oh my God, he tells everyone.
He raves about it. That is absolutely how I heard about Marissa in this place.
Yeah. So that's where my passion is, that life-changing experience, right? With my background in facial plastics and trauma and just being in the OR and being on the other side of that, it's hard because you don't see your patients again, right? They come in through the ER, you operate on them, you may see them once or twice in surgery, facial removal, and then that's it. So you don't really experience the other side of that journey. And now I'm on the other side of the fence, and it's so fun because I kind of know what they've been through. I've been there and know what the tissue's gone through, and being able to kind of help with the long-term side of that is so rewarding for me. And that's why I'm here.
That's awesome. Okay, let's talk real quick, the vaginal rejuvenation. That's radio frequency as well. You said it's a wand. How does it work?
Yes, it is nicknamed the Magic Wand.
Okay.
Saving one marriage at a time. There we go. It's a wand that we insert in, and our goal is, again, we kind of treat deepest depth first. It rotates around, introducing the radio frequency, so that hand piece I was talking about earlier, where it's smooth and kind of moving. It's a similar kind of technology. It's on the different wand, and so we'll treat like 1/3. We change the heat based on assessment. That's one you really do need to be careful with because hormones play a very, very vital role in the thickness and dryness and the surface in there, right? It's also deep, and sometimes it's dead. There are a lot of different ways and types of trauma to the vaginal canal. So just being aware of that, but a rotational deeper third, and when it goes in the middle third, then we go towards the external rep century. And it's about a 30-minute procedure time. It's not painful. It's a little invasive, but we're trying to make the environment comfortable. It's similar if a lot of women say like, oh, it's like getting an ultrasound via vaginal versus external. Again, not painful, but warm. And women report noticing an immediate difference. You have a little bit of drainage.
I was going to say, what are people coming in for? Like, or what should people
so
come in for?
The way the radio frequency works is it increases blood supply. And that's a huge thing all on its own, right? Because as hormones drop down and our body basically says like, you're not in baby making mode anymore. Things get dry, they get thick, they get uncomfortable. So bringing that blood flow back and re-nourishing that tissue is a major win. And then the collagen and elastic building. So when all of that kind of shuts down, if you will, radio frequency.
What age is it, or what time of life?
Most commonly, I would say probably most of our clients come in are between 40 and 55. Okay. So after childbearing, not that it has to be, we do have some women in their 20s and 30s, and their goal is tightening and lubrication. Some women are just born drier, and this really, really helps be able to produce your own natural lubrication. And a lot of that is just that tissue health right here. And blood supply, nourishment. And then tightening is another big one. By 40 to 55, you've probably had some sex in your life. You've probably had some kids in your life. You're aging, so you kind of have all things against you by that time frame. So we really do a lot for all of those, for tightening and the lubrication and comfort, and then you have the nerve side of it. So women who have a really hard time getting a bowels, 50 to 60% of our patients, they're like, I climax faster, easier, and longer. So I think if you can hit any of those,
everybody should want those.
So it's fun. But again, if there are certain things, you asked me with microneedling, who's not a candidate, certain types of birth controls, they can be a problem with that. So that's the biggest reason we worry on. But those are the metal devices, right? Because we're adding heat. So that's my biggest question. A lot of the newer ones are when we grab this plasticky substance. Those are great. I've talked to a lot of these, and I tell them
but like copper, you use.
I wouldn't want to do copper. That's the biggest thing. So those are really the only candidates that I wouldn't recommend it for. And again, it's not that they can't get it. I've had women take them out to get this.
Oh, interesting.
I'll get it back in later, or maybe I won't. So that's what it's a conversation.
What are comparables? Like estrogen cream does some of the same things, at least it like lubricates the area, so moistens it.
And that's really it.
There's not a lot of options.
There's not a lot of options. Estrogen is nice for lubrication. Some women report that it helps with sensitivity just for obvious reasons. Hormones are balanced, things are communicating better in the body in general. But we have the Emsella chair. That's not radio frequency, but it's called high fidelity technology. So it's similar to like a sound magnet. You sit on the chair and it contracts your whole pelvic floor. And
interesting.
It's so intense. A 30-minute session is 12,000 kilos. Okay. And you're posted up on the chair, even your quads are contracting. So people's bodies usually move.
Okay.
That has been very, very successful. And in comparison, it's not invasive, right? You don't have a wand in your vagina, you're sitting there, you're fully clothed, you're comfortable. We're going to be careful with that is the primary speakers.
Okay, so there's a lot of intensity.
It's intensity, it's close, but that's awesome for sexual arousal, and a lot of that again is you're building that pelvic floor. It's very, 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 very successful for that. In fact, we have a client right now who was at a pelvic floor specialist, got measured intravaginally. In 1.5 months with us, 6 treatments on the Emsella chair, her pelvic floor raised to double what it did her pelvic floor specialist in a 1-year period. So she just did this huge testimonial for us and was crying in our room and was like, this is amazing. Like, I'm on a chair, I'm clothed. It's been a month and a half. I'm not peeing the bed. I haven't put it lap. My sex life is awesome. I'm not holding myself, discomfort. So that's probably the biggest,
huge thing.
Yeah, huge things. And a lot of women, especially 40 and above, some women even in their 20s and 30s have like SI joint issues, stabilizations.
Lots. So you're with childbearing will cause this.
Sciatica, all that. So the M-cell chair, that's where it's optimal to the vaginal wand, in my opinion. But I think the vaginal wand is optimal for vaginal canal type. And so when people come in, we look at what all the issues are. That's the biggest benefit. What do we do? And then we have treatment protocol where we alternately do a vaginal wand and cell chair treatment, the vaginal wand. So I'm on it all.
Yeah.
I don't want to pick and choose. I want the optimal of both. So that's a great treatment. And we do a lot of those. Our chair and I want it all the time.
That's awesome. So do you work with physical or like pelvic floor therapists?
We do. A lot of our actually M-cell chair. We do the M-cell chair for a lot of men post prostate cancer because again you're nourishing that tissue.
Right, and they have problems with leakage afterwards.
A lot of leakage, a lot of swollen swimmers. We have quite a few men right now. Very peaceful things. We have some husband and wife who come in and we sit them back in a chair.
Together. They're next to each other.
Alternating.
Yeah,
no lap treatments.
Yeah. I meant like two of them next to each other. That'd be quite the experience.
Yeah.
Oh, fascinating. Anything else like new and exciting that you are like that's coming in here that's on the horizon that
we are playing more and more with combo treatments with the biostimulators and the exosomes. So there's a lot of people don't really understand what an exosome is. I like to explain it as it is a superfood for like cellular repair on many levels. And the fun thing with the exosomes is there's a lot of ways, again, you can introduce those. So we're combining those in a lot of our scar rejuvenation as well as the biostimulators. So like our exosomes, they're found in delicate DNA. So they're huge for recovery, scars, anti-aging, significant anti-aging. I like to tell people like adding exosomes onto one arm of iron healing versus similar results as if you had two arm treatment. So you're kind of double dipping. And you've got those channels from all those needles down deep where the blood supply is stronger, right? And you put a topical exosome over like a face cream, and that's driving through all those holes, and you're just accelerating that, right? Your body's not having to process and transfer to the site. It's to the very local to the design. I think that's why she's alive. So fantastic. But as technology increases, PRP has been a huge thing. It's still a huge thing, but what most people don't understand about PRP is it's only as good as it's known. Right. So how healthy are you? How many RBCs do you have? What does your diet look like? If I draw your blood and spin it down,
is it still crappy blood?
Is it crappy blood? Yes, good way to say it. Whereas exosomes and biostimulators, they are a constant result.
What are biostimulators?
So biostimulator, my favorite one is Radius, and I do a lot of Radius Hyperdilute. It's an injectable, kind of blended with a little bit of gel area, almost like a filler, but it's got another different component. And the idea is kind of, you get this immediate result because you've got a little bit of filler component you're adding volume.
Okay.
But as your filler side of it sort of goes away, if you go or dissipates, you're building this collagen at the same time. So my father's face, Radius Hyperdilute is what I injected in him. We got an awesome immediate fill of those tissue deficits once we release the collagen
Give some
bands.
space.
And then every month for the next 3, 4, 5 months, you just got better and better results. And probably now, if you
So you get him in treatment yet? Does he come in regularly yet?
He's been coming regularly, and he has many future treatments.
I'm sure.
I think his comfort threshold, and my father's a great example of what I wanted to bring to this practice. Right, we're not a med spa.
It looks like a med spa. It's beautiful in here, but yes,
we do all the traditional med spa treatments, but so much more. I love the functional side. I love the life-changing side. I love the vaginal treatments. I love the sexual health. I love the scars. My biggest thing. That's where my passion is.
that is awesome. You've already answered, I think, most of my questions. Obviously, how Aspire Med Spa plays a role in healthy aging. It sounds like a lot of just more than just the superficial, more than just like how you look as you age. Like keeping sex good as you age.
Yeah.
That's huge. You know, keeping your urinary like control.
Yeah.
So,
Yeah. I mean, all those things, they give it as team players, right? How is your sexual health? How is your physical health? How's your blood pressure? How's your weight? How's your hormones? How's your, skin superficial layer like? And once you create these treatment plans where you're tapping into each of those systems, and we do a lot of like pulling people out of adrenal suppression from deep stress, and just it's like people come in and they're a different person. They look different. They feel different. The way they walk is different. They're finally sleeping, and their confidence is up. And it's kind of fun. Like a lot of women come in and they're like, I'm nervous about the finances. How do I talk to my husband about this? My answer is always bring your husband in. And now husbands are coming in and they're buying gift cards for these women, and they're like, I don't care what she uses on. I just want her to keep coming back here.
that's awesome.
So it's fun. I think that's a testimonial on its own. Is a lot of education, right? And a lot of, you're not going to treat one thing and feel amazing, and it's a bigger picture there. And that's the journey. Right?
Yeah. Is there any like myth that people have about med spas or about your place or any of these things that you'd like to bust for us?
Great question. Yes, vanity. I have a lot of people who come in and they ask questions, and something has been bothering them for years, but even 15, 20 years ago, aesthetics was not nearly as accepted as it is now.
Yeah.
Now, especially for men, like that's a whole other great conversation. It's like normalizing this, right? Like it's not vanity. When you come in and you're treating a scar that you're symptomatic, it hurts. It's affecting how you put sunscreen on, right? Or your makeup. And you fix something like that, that's not vain. You're changing your life for the better. Now,
Right.
if you're coming in and you're getting a full syringe of lip filler and you're coming back in a month and you're doing that again and again and again, I think for a while that's where people's minds went, or like the movies with the freaky Botox, or
Right.
when it uses straw, right? So I think there was this negative association, and initially people weren't finding wellness in aesthetics. I think that's a newer breakthrough, and people have gotten smarter, and people have seen change in the power of when you do blend health with wellness in beauty.
Right.
And what that
right.
looks like.
That is one of my goals with this podcast. Like, let's talk about all of it.
Yeah.
And do it in a healthy, sustainable way.
Absolutely. And I love what you talked about earlier, right? Like bone density. That's a big deal. And it plays a role in body contouring. If I have a lady who comes in and she's really weak bones, like that's her structural integrity, right? So again, I keep going back, like you want to start with the deepest layer and you got to build out from there. What does your foundation look like? And I think I love your podcast for that, because I think you're going to educate and reveal a lot of things where people can finally put the whole puzzle together, where maybe they've had some pieces. I'm not a big social media person, but I will say all these reels and memes that are coming out that are actually science-backed stuff, I love the education side of it. Like it's bringing light and access to things where people don't have to go to these huge classes. They don't have to leave the state. They don't have to go, into an anatomy and physiology class. And it's just the more education and the more technology, the more stimulator science comes out, the stronger what the industry's gotten, the more you can do.
Right. Awesome. Well, thank you. Thank you for your time. How can people find you and Aspire Med Spa? Find out more.
We are on the corner of Denali and 36th, but we have a great website, aspiremedSpa.com. You can look online, see all of our services in there, but I encourage everyone come in for a consultation, talk to us about what's going on, and then we'll set up a treatment plan.
It's a beautiful space.
Thank you.
Thank you.
Thanks for listening to On the Ascent Health. If you enjoyed today's episode, make sure to subscribe so you don't miss what's coming next. And if you found it helpful, share it with a friend and leave us a review. It helps more people discover the show. The views and opinions shared by guests on this podcast do not necessarily reflect my own or that of Ascent Health and Performance. The information provided is for educational purposes only and should not be taken as medical advice. Next week on the show, Dr. Laura Huey is here. She is a physical therapist who specializes in pelvic floor therapy for women. She'll offer her perspective, including fact-checking a few things we talked about today.
If you've ever wondered what's actually normal for pelvic health, what needs treatment, and what's just bad information on the internet, this is the episode for you.